And NIH had just funded some studies that showed with a single pill, you could prevent 50% of transmission from mothers to children.
And that was a priority.
That was a huge priority, and it's also pretty easy politically. But it's a single pill. And there was a real sense of, and this gets to the data, that most people in public health thought it was impossible to do something as complicated as delivering daily therapy. In fact, at the time, it was twice daily therapy. And so we thought, well, it's a single pill right around the time of delivery. The woman's coming in for delivery. That's pretty easy. And it's really effective and not that expensive. So that's what we should do. And Tommy went, and it's also just gut-wrenching when you're holding these kids who are going to die. And they didn't say anyone on treatment because there wasn't anyone on treatment in Africa at the time. So we put together the Mother and Child Initiative, which was $500 million over 5 years. Put that in context, that's a massive increase over what existed. Focused on the countries where there was the most HIV infection. And to put it in context, there were districts in Botswana that had 75% of pregnant women who were HIV positive. 75%. They were all going to die, and most of their kids were going to die. 50% of them were going to get HIV. So the plan was, well, let's at least protect the kids. So this initiative over 5 years would reduce that transmission by another 50% to get it down pretty low. We were pretty happy about that. The president, Josh and the president agreed to it. Tony went down for the signing ceremony, and Josh pulled him over and said, this is a great start, but the president said, think big.